Good afternoon, Dr. Barry G., Houston's dancing psychiatrist, wanting to talk with you all about an article I read earlier this morning. It was a really interesting article talking about possible reverses cause of dementia. We know that dementia, as the aging population becomes more prevalent in America and in the world, because I'm meaning this to not just be heard in America, but throughout the world, that it is the possibility that dementias might right away be thought of as neurodegenerative, meaning something that we can't necessarily do something about, although that's changing, like Alzheimer's disease and other types of degenerating dementias, which there are slowly becoming treatments for. But I want y'all to be on the lookout and to talk with your clinicians about the possibility of possible reversible causes of dementia. And one of those reversing causable dementias is something which could be secondary to hepatic encephalopathy. In other words, problems with your liver, whether it's fibrosis or cirrhosis, can lead to elevation of liver enzymes, can lead to elevation, destruction of liver pathology, but not be full blown where it's necessarily fatal at that point, but still can cause problems with cognitive disturbance, which can look like a neurodegenerative dementia. So if you or a loved one is having changes in cognition and memory impairment, one of the things to look at is, are liver enzymes elevated? Are other factors involved in fibrosis factors, age, liver elevated aspartate levels, elevated liver enzymes levels, elevate lower platelet count. So once again, elevated liver enzymes, also elevated aspartate levels, also evidence of uh, other low platelet count, as well as age. So age, lower platelet count, elevated liver enzymes, elevated aspartate levels. Are they potentially affected? And if they are dysregulated, if they are imbalanced, and patients have a history of either alcohol abuse or current use, or a history of Hep B, hepatitis C infection, i.e., some reason to have liver dysfunction, this could be a potentially reversible cause of cognitive difficulties, which might be reversible. In other words, people could have undiagnosed cirrhosis or undiagnosed fibrosis, and that could be leading to hepatic encephalopathy, which basically can manifest as cognitive disturbances. So be on the lookout for you or a loved one if that happens, and look at that possibility of asking your clinician to look into the possibility of this, because this could be a potentially reversible cause of cognitive difficulties and cognitive decline. This is Dr. Barry G., also known as Houston's dancing psychiatrist, wishing you all an amazing day, and you all be good.